Apprehension test can also be done in supine position. So what do? You're abducting, externally rotating. You take your hand, you place your fingers posterior to the humeral head. I bring this arm all the way back and push from P to A, right on the humeral head. Is that comfortable? No discomfort. Good. Okay, and so if it was uncomfortable or felt like it's going to pop out, it's unstable, or there's pain or she doesn't let me get in that position, then we do the replacement or relocation test. And remember, when I do that, I'm going to take my hand, broad contact, not right on the humeral head, because that'll give me false findings, but just a little bit distal on the shaft of the humerus with a very broad contact. And I'm going to actually act like the anterior capsule. I'm going to hold the humerus in place while I externally rotate, coming into that same position. So a positive finding is when this is more comfortable and there's greater range, and this is less comfortable and there's less range. You with me on this? And that confirms the apprehension test finding. So you don't do the replacement or relocation test unless you have a positive apprehension test. And then that can confirm whether or not this is really due to instability. You with me on this? Okay, so have me sit up again. Okay, so that's for the, turn facing this way. You guys all come over here. Again, I'm just trying to figure out how to use my arm. Okay, so next we have the Sulcus test. So we're just going to do some of the tests we did yesterday in lecture. And so with the Sulcus test, that's for anterior instability, which is the most common instability. So the Sulcus test, we're going to be testing for inferior instability. And we're looking to see if when she's relaxed, if I distract the humerus distally, you can create a notch between the acromion and the humerus. And so again, I need to know where that is. And so now if I just push down like this, she's going to fall over. And if she, to prevent herself from falling over, she'll tighten these muscles. When she tightens these muscles, I'm not going to get the finding I want. I want the muscles to be relaxed when I'm doing this. So I place my hand on the shoulder girdle, and I'm going to be putting a little bit of a lateral to medial force, so that then broad palm on broad contact on the forearm. Notice also I have the hand in her lap. That internal rotation helps to loosen the anterior capsule, so I'm really testing the joint here. And I simply distract inferiorly, just exactly like this. And now for this, you need to look at the humerus. You know, it's a visual finding of a little notch that forms here. So this is normal shoulder. With me on this? Okay. A lot of people who are normal, typically slender women, have a positive test. So if someone has a test in this room, let's get it so everybody can see. And that's not something to worry about. Remember, that's the difference between ligamentous laxity and pathology, which is instability, pathologic instability. The second test that we want to practice is the Faegan's test. So the Faegan's test, I'm going to sit next to her, and I'm going to remember put the elbow on my shoulder. Just let your shoulder relax. Okay. I interlace my fingers, and now your position is very important, right? Because if I'm on the acromion, that's not going to test the glenohumeral joint. I need to be distal to the acromion. And there's no thrust involved here. It's simply stressing in an inferior direction. And to see if there's any pain. Is there any pain when I do that? Good. And a simple positive finding is pain. Okay? So here's what I want you to do. Apprehension test seated, apprehension test supine, relocation test supine, and then the two seated tests for inferior instability, the Sulcus test and the Faegan's test.